Okay, finding sites. I always recommend people take their needle off of their syringe, and that way then you can practice with it. Your family won't run from you then. You're looking for the deltoid, you're looking for the acromion process, and once you find the bottom of that, then you want to go 2 to 3 finger widths down, depending upon the width of your fingers. If you're a real small person and have tiny fingers, you might want to use 3, and then you'll go right below it. Once you've found the site, then you don't have to keep your fingers there any longer, but you visualize it, pull the skin taut, inject, stabilize, aspirate, and inject. Okay, so there's your deltoid. Hang on. Alrighty, for the ventrogluteal, I want to find the greater trochanter. So if you'll kind of bend your knee forward some, let me feel where it bends here. Lift it up and swing it. Okay, alrighty, over here. Okay, so I'm finding the greater trochanter. I put the heel of my hand on the greater trochanter. I am looking for the highest point anteriorly on our hip bone, and it's actually easier if you're laying down, because our muscles are tense right now. But anyway, we'll point your middle finger towards that anterior superior iliac crest. Spread my fingers wide, and it should be about right in this area. You might feel then, once you get that area, feel a little to the left, a little to the right, but just kind of feel for the best muscle there. Okay, and again, once you've found it, then you move your hands, spread, inject, stabilize, aspirate, inject. Okay, turn around just a second. So, it's still good, yeah. Okay, greater trochanter, and then I'm following the hip bone around until it meets with the spine in that area. I'm making from here to here an invisible line, and I know then that I can do this upper outer quadrant. The sciatic nerve will vary in people. It usually goes from about this area and down the center. So I want to go more for upper outer, and I'm basically going for a part that is, feels like it has depth to it that I can inject. Okay, finding the vastus lateralis. Basically, it's going to be the center third of the thigh on the outer side. I can find the greater trochanter and basically put a hand there, and then right at the knee, then a hand there. And so again, it's going to be the center third. I don't want to inject any further over than the midline anteriorly, so I want to stay in this area, and nor do I want to go any lower than the midline laterally, and inject. Alright, I stopped because I had an available model for doing sites, but we will go back to withdrawing from an ampule. Let me put this back in a package here. So anyway, ampules are scored around the top here so that they will break more easily. Often medication gets caught in the top. You want to click on them until it falls out. In some cases, when you have a tighter neck here, it's real hard to get the medication out. That with this one, it falls out pretty easily when you just flip it. But if it's difficult to get it out, if you take it and swirl it, that medication will drop right out of there, so it won't be a trouble. What you want to do then is cover with, actually the best thing to have is a couple of large alcohol pads. Ours, that we have here are kind of on the smaller side. In the hospital setting, most usually they had a larger one. These just are not large enough because your concern is contamination at this upper edge when you're using something other than alcohol. But what you want to do is break your ampule away from you. Okay, so what I'm doing is pulling back on the top and the bottom and pushing out in the center. So I'm going to break it. Okay, I will put the top of this in the sharps and then get rid of my paper towel. And then to withdraw from this sharp, I'm going to need a filter needle. This needle is just like the blunt. So here's the blunt. Basically the filter has an extra chamber on it. It has a piece of filter paper down in there, which you can normally see by looking down in there. You can see the white filter paper. And that is to catch potentially little shards of glass that you might be withdrawing here. So I have this. I've already opened it. I'm going to remove my syringe, leaving my sharp in the container. Put it on there tightly so it doesn't leak. And then I can simply access my vial. Certainly I don't need to put air in this because it's open to the air. Any air I try to put in it is going to come right back out. As opposed to a vial, anytime I'm going to withdraw fluid from here, I need to replace it with air. Otherwise I'm going to create a vacuum in this and the sides are going to suck together. You'd think that they couldn't, but they certainly will if you don't replace it with air. And one good thing about this is I don't have to worry if someone would knock my arm or whatever. I've got my needle down in it. This is stable. It's not going anywhere. I'm going to withdraw my fluid. I want to withdraw more than my dose. I'm not going to be concerned about getting air out. And I'm going to do my one-handed recap, scoop and swoop, and get rid of that. Again, potentially it has shards of glass in there, so I'm not going to be pulling back and forth with my fluid level. I want to get rid of this. I put this in the sharps. I can then get my sharps out of here. And now I'll get rid of my air. Pull down. I like to get all of my air to the top. They've got a little air bubble here. Just kind of turn it around, flip on it till you get that to go up. Sometimes you can dislodge it by moving it back and forth. Okay, alright, so I'm going to hold this exactly straight up and down and push my fluid level up to the top edge of my syringe and stop. And then I'm going to lay my syringe horizontally and with my bevel down, and if you can't see, turn it around so that you can see your numbers. Just change hands with it, and then push it out to the end till you get your dose. Click it off, and then you're ready to recap, label, and go to the patient bedside. Okay. Normally, when you have fluid in an ampule, it's not going to come out unless, I don't know, there's a certain way you move it and it will fall out. But so you don't have to be be real concerned about moving around with these. Just make sure you're not contaminating this upper edge. And it's easy just to sit them down on the table, withdraw your fluid, and then place this in the sharps. You need to know the normal amount of medication that you can inject into each site. You need to know the different lengths and gauges of needles that you'll be using for an IM injection. You know that with an average size person you're going to use 1.5 inches. With a very thin person you're going to, and I'm speaking of adults, with a thin person you're going to use a 1-inch needle, and your average gauge, usually around it, if you just, they give you a range, but if you say 22, and then you might be a little smaller, a little larger, but you'll get it there. You know that an 18 gauge needle is larger than a 22 gauge needle. An 18 gauge is what you're usually going to be using to, or if you're giving blood, or if you're filling with a vial. Our blunt needles are 18 gauge. So, and this one I've been fooling with here is a 23. So, anyway, I think, and that will be what you need for this checkoff. More to come next week.